What is the right age to get a facelift done? Am I too young to get one? Let's try and find an answer to this question today. I'm Dr. Mrinalini Sharma. I'm a plastic and cosmetic surgeon practicing in Aestiva Plastic Surgery Clinic, Sagging. Today in this video, we're going to be talking about the right age for getting a facelift done. Increasingly in our practice, we are now coming across both young men and women who are concerned with signs of facial aging. And a paradigm shift we are seeing these days is that now most of our patients want long-lasting solutions. Some of them have had no previous procedures, and some of them have also been using fillers or Botox regularly. And I'm seeing patients as young as 30 years old or sometimes even in the late 20s. So the question arises as to who can undergo a facelift and how soon can the person undergo a facelift. So today in this video, I'm going to be covering these topics and giving an insight as to what is the ideal age for getting a facelift done and what are the possible options we have in younger patients. So why the need for a facelift? Younger patients these days are more and more asking us for a permanent surgical solution to their aging problems. The downside of getting the non-surgical treatments like Botox or fillers, as we all know, is that these last only for a short duration. So for example, Botox, if I say, is going to last for just about 5 to 6 months. Fillers again have a maximum life of about 2 years depending on what kind of a filler is being used. So this is why these days everybody wants a more lasting and a permanent solution to their problem, and here comes in the role of facelifts at a younger age. So now let's think of the possible options available when we're talking of a facelift in a younger patient. The first concern of anybody who's opting for an anti-aging procedure is that nobody should come to know. So this is even more important in the younger patient. The first concern we have is that if you're planning a facelift in a younger patient, we are looking at minimum scarring. The more common procedures which can give this kind of a scarring are, say, something like a mini facelift or a ponytail lift. So these are all fancy terms which indicate the length of the incision and the minimum scarring associated with these procedures. Question arises, who is an ideal candidate for a facelift, more so at a younger age? I would not recommend a facelift to everybody who walks into my office at the age of say 30, 32 and asks for a facelift. The most important criteria is how much sagging is there. So there are many young girls and young men who come to me and think that facelift is an answer to the first signs of aging. So if you have a wrinkle there, you should get a facelift done. It will solve your problem. If your skin is uneven texture or slightly saggy, your nasolabial folds are a little pronounced, facelift is the ideal solution. No, that's not the case. Facelifts in younger age groups are not that common, and I would recommend that only if, say, you have lost a lot of weight and you have developed signs of facial aging. So say you are in your 20s and 30s and you have lost something like 20 or 25 odd kgs over a period of 1 year or 2 years, and now you're concerned that your face is all droopy, you have prominent nasolabial folds, your jawline is not well defined, and obviously you feel that the weight loss has not really given you much in terms of your facial appearance. Here is the role of a facelift in a younger patient. I can restore the jawline, and I can also take care of the nasolabial folds in a much better way using a surgical facelift in this kind of a patient. I would not recommend this to a person who has tight skin and no sagging. So now let's come to the older patients. Say somebody in their 40s and 50s. The facelift in them will be slightly different from somebody in their early 30s. Now, as we age, other signs of aging also begin. Now, I can look at the eyes of the patient. I'll find droopy skin. I'll find that the eyebrow is a little droopy, especially the outer third. We can have eye bags. We can also have loose neck with a prominent jowling in the area of the jawline. So now I'm going to be requiring something more than a basic facelift or a mini facelift. I would then combine a blepharoplasty or say something like a neck lift. In some cases, I would also want to add some, say, fillers or fat into the neck along with the surgical facelift, which is mainly designed for the mid-face and works just for the younger population. So as we age, the number of procedures which we are adding to the facelift will increase. In even older patients, we'll also contemplate doing a forehead lift or a brow lift because droopy brows will also progressively appear. So to conclude, a facelift is a very good procedure for dealing with signs of facial aging. However, I would like to emphasize that facelift is not a one-stop solution for all your problems. If you have fine lines, you would still require a Botox. If you have pigmentation, you will require a treatment for that. Also, if you have things like open pores, you might require ancillary treatments, say a chemical peel or a Morpheus 8 to give you improved skin texture. Also, a good skincare regime, say using a sunscreen or retinoids or a vitamin C serum, is an important part of your skincare regimen after getting a facelift done to give you long-lasting results. I hope you found this video useful. Please like this video, share this video and subscribe to our YouTube channel. Also, don't forget to press the bell icon for more such informative videos. Thank you.